Tenex is a much better surgical option than the traditional ways that they did surgery for Achilles tendonitis. However, it is still surgery and it does have side effects. So in this video, I'm going to explain how surgery may help Achilles tendonitis recovery. We're going to look at why Tenex is a better option than the traditional ways of doing it. We'll also look at why it's not a silver bullet and shouldn't be your first choice of treatment for Achilles tendonitis. And then we'll look at what things should you be trying first before you have the Tenex procedure. For those of you who don't know me, my name is Maryke. I'm one of the physiotherapists from treatmyachilles.com, where you can get online physiotherapy assessment as well as treatment for your Achilles injuries. Have a look at the description of this video if you want a link to our website. So how is surgery meant to help Achilles tendonitis? Well, to understand that, it's useful to quickly look at what happens in the tendon when you injure it. So when you have Achilles tendonitis, a part of that tendon is affected, and tendons are made up of lots and lots of collagen fibers that are stacked together in bundles in parallel, and it's that parallel structure that makes it so strong. Now, the portion of the tendon that's injured, in that area, the fibers become a little bit disorganized, they lose their parallel structure, so they lose some of their strength. You also get that you have little blood vessels and nerve endings that grow into that portion. And it is currently thought that those nerve endings are the main reason why you get pain when you have Achilles tendonitis. So with surgery, surgeons go in and they remove that injured part of the tendon, as well as those nerve endings and little blood vessels. And what happens then is you have less pain because they've taken that bit away. Now, the problem with that is that the first type of surgery people used to do was open surgery, and sometimes it's still used, but luckily not that often, because opening up the Achilles tendon with a large incision and using a scalpel on it causes quite a bit of scar tissue, and that didn't give good results. Then they started using arthroscopies, which is just a little camera that goes in, and that creates less scar tissue, less chance of infection, so that was much better. But now we've got Tenex, which is a much better option for surgery because it only uses a needle that goes in and uses ultrasound and small incisions to take that injured tissue away. However, it is still surgery, and it's interesting for me how some websites try to make it sound as if it's not surgery. They make it sound as if, oh, you go in for this procedure, you have no pain after that, and you can just go on with your life. But that is just not true, because if you just take the injured part of the tendon away, you're changing the structure of the tendon in the first place, and you're not really changing anything in the whole injury process. So your tendon has still got decreased strength. So if you don't do any strength training and follow a proper rehab plan afterwards, you're very likely going to develop Achilles tendonitis in a different part of the tendon. So that's the first reason why Tenex is not the best option, or you can't just do Tenex and not anything else. Then, Tenex can also cause side effects, and some of them can be quite serious. So there's been reports of DVTs, or deep vein thrombosis, also known as blood clots, after the procedure, spontaneous Achilles tendon ruptures, then wound infections, wound ruptures, hematomas, which is just a collection of blood under the skin, nerve injury, as well as gout flare-ups. Now, I know these sound quite serious, but don't worry, they're not actually that common. The incidence rate is quite low. So 2 studies of note. The one was done on 189 tendon procedures, and only 3 incidences were reported, and 2 of those were serious. And in another study, they did 298 procedures, and only 2 people had side effects, and they weren't serious side effects. So they weren't DVTs or ruptures. And to be honest, the serious side effects can probably be avoided if you follow a proper rehab plan afterwards. And the reason I say that is that second study did the Tenex procedure, but then they also required their patients to follow a very set rehab plan afterwards. And by the way, I will make a video where I discuss the rehab after Tenex procedure for Achilles tendons. So check the description of this one if you want a link to that one. We know that directly after the Tenex procedure on your Achilles, you'll likely be placed in a boot. And as soon as your leg is immobilized in a boot, your risk for getting a blood clot goes up a little bit. But if you do gentle movements throughout the day with your foot, you can reduce that risk because you improve your circulation. And that's what they did in that second study. So that may be why they didn't have any blood clots in that study. Secondly, if you're wondering how can the Tenex procedure cause ruptures of the Achilles tendon, well, it's likely not the procedure directly, but the fact that people didn't have pain after they had the procedure. So they thought, well, I can get on with my normal daily activities. But they hadn't done anything to restore the strength of the tendon. And then they just simply overloaded the tendon through normal activities, and that caused it to rupture. So another reason why it can be really important to follow a rehab plan after you've had Tenex. Then lastly, we don't actually know how the Tenex procedure affects Achilles tendons in the long term. So there is some evidence that it can help short-term improvement from Achilles tendonitis, but we don't know if we look at you a year from now, how are your results compared to people who didn't have the procedure and used other things? Are you at the same level as them? Are you worse off than them? Or are you better than them? So we just can't tell yet. The current advice from researchers is that you should only consider any type of surgery, so this is Tenex as well as traditional, after you've tried a proper rehab plan for at least 12 months and not seen results. Now, why 12 months? Because that sounds very long. Well, that's how long tendons take to recover. They're made up of collagen, and collagen takes a very long time to produce and strengthen. Also, I mentioned proper rehab plan. The problem with the rehab plans is that we often speak with patients and they say, no, exercises don't work for me. And then you listen to what they've been given and it's just the totally wrong thing for their tendon. It might be the right thing for somebody else's, but not for their situation. You've got to remember that we all have, our tendons have different strengths. They don't cope with stretch equally well. So sometimes a typical thing we see is that the patients have been given the Alfredson protocol, where you do lots and lots of heel drops over the side of a step, and they're just not getting better. But it's because they're actually overdoing the rehab. Their tendon can't cope with what they're doing, and it doesn't like that stretch position, so the pain is continuing. Then the other thing we see is that people find the exercises are fine, but they're still unable to run. And often the reason for that is they've been stuck at the same level of exercise or type of exercise for too long, and because the rehab is not progressing, they're not gaining strength, so they can't get back to their high load activities. In some cases, it's simply that they are doing other things in their life that's irritating it, like for instance, loads of calf stretches or doing too much walking or too much running if they're still continuing to run. So it's really important that that rehab plan is structured to you and that those exercises are right. A clear giveaway that your rehab plan is not right for you is if you find your pain increases significantly within the 24 hours after doing your rehab exercises, or that it's just not changing at all despite having done your rehab exercises consistently for 3 to 4 weeks. If that's the case, definitely speak to your physio because you need a different plan. I've made a whole video about the other treatments you can use for Achilles tendonitis, where I looked at the research to see whether they're useful or not. If you're interested in that, have a look at the description of this video. I'll put a link to that one there. Brilliant. Hope you found that useful. Now remember, if you want a link to that video about the rehab plan after having the Tenex procedure, I've put a link in the description of this video. And also, if you need more help with any type of Achilles injury, you're welcome to consult one of the team via video call. The link to our website is also in the description of this video. Take care.